Today we are going to learn about pharmaceutical dosage forms. Dosage forms are the safe, effective and a stable term in which the medicament will be delivered into the body. Here dosage forms are essentially pharmaceutical products which are marketed for use, typically involving a mixture of active drug component and a excipient. Here excipient is a non-drug component. It doesn't have any medical value, but it will improve the action of a active constituent. In sometimes it will stabilizes the product. So these dosage forms are classified in a number of ways based on form wise, that is the name itself indicates on the basis of the state. First one is solid dosage form. So these are the dosage forms which are solid in nature, obviously. Example for this is capsules, tablets, pills, like that. And second category is liquid dosage forms. So these are the dosage forms which are in liquid state. Example syrups, elixirs, linctus. And third one is semi-solid dosage forms. These are the dosage forms which are in semi-solid state. Example for this is ointments, creams. And next one is on the basis of route wise. So here the dosage forms are again classified on the basis of the route of administration. First one is oral dosage forms. So these are the dosage forms which are intended to be administered orally. Example tablets, capsules, pills, syrups, elixirs. And second one is topical dosage forms. These are the dosage forms which are intended to be applied to the skin. Example creams, ointments. And third category is parenteral dosage forms. These are the dosage forms which are intended to be administered other than oral route. So the name para indicates other than, enteral means intestine. So parenterals are the products which are intended to be administered other than oral route, like in the form of injections, infusions. So based on the release wise, they are again divided into so many types: sustained release, prolonged release, controlled release, targeted drug delivery. So here sustained release dosage forms are the medicaments. They are intended to be released the drug in a sustained manner. And the second one is prolonged release. These are the dosage forms which will produce a prolonged action. And next category is controlled release. So these are the products which will release the drug in a controlled way. And the fourth category is targeted drug delivery system. These are the dosage forms which will release the drug at a targeted site of action. Example for this is implants, entry-coated tablets. So entry-coated tablets, they will release the drug in the intestine but not in the stomach. Here solid dosage forms. These solid dosage forms are mainly divided into two types, that is unit dosage forms and bulk dosage forms. These unit dosage forms are again of so many types like tablets, pills, sachets, capsules, powders, suppositories. Again these tablets are of so many types. Example lozenges, oral tablets, buccal tablets, sublingual tablets, chewable tablets, soluble tablets, hypodermic tablets, coated tablets. Again these sachets are of so many types like dry seal sachets and wet seal sachets. Like this, capsules are also two types, that is hard gelatin capsules and soft gelatin capsules. And suppositories are divided into ear cones, rectal cones, vaginal cones and nasal cones. These bulk dosage forms are of again two types, that is for external use and for internal use. For internal use they are of two types, that is fine powders and granules. So these granules are again divided into two types, that is non-effervescent and effervescent. Bulk dosage forms for external use, they are of again so many types like tooth powders, ear powders, snuff powders, ophthalmic powders and dusting powders. Next one is liquid dosage forms. So these liquid dosage forms are mainly divided into two types, that is monophasic and biphasic. Here monophasic is of again four types, that is for internal use, for oral topical use, instillation into the body cavities and for topical use. For internal use they are again of two types, that is aqueous and hydroalcoholic. For aqueous they are of four types, that is drops, mixtures, solutions, syrups and linctuses. For hydroalcoholic, elixirs. For oral topical they are of three types, that is mouthwashes, gargles, throat paints. For instillation into the body cavities, example for this is ear drops, nasal drops, sprays, douches, enemas. For topical application they are solutions, lotions, paints, linctuses. Example for the biphasic liquid dosage forms are emulsions, suspensions. Next category is semi-solid dosage forms. These are the dosage forms which are in semi-solid nature. They are divided into two types, that is for external use and internal use. For external use, examples are ointments, pastes, suppositories. For internal use, examples are gels and jellies. And the first dosage form is aromatic waters. So these are the saturated aqueous solutions of the volatile oils or other aromatic or volatile substances. So simply they will prepare by mixing the oil with water. Example for this is camphor water, peppermint water. And the next one is catechets. So these are the solid dosage forms which are meant for administration of a nauseous and disagreeable drug substances. So these are molded from a rice paper, a material made by pouring a mixture of a rice flour and a water between two hot polished revolving cylinders upon which a water evaporates and a sheet of a wafer is formed. So this is how we will prepare the catechets. So after preparation, how to fill these catechets means, so in filling of catechets, the medicament is placed between the two pieces of a catechets which are then either wet sealed or dry sealed. If they are sealed by wetting, they are called as wet catechets. So these catechets are made in variety of sizes holding from 0.2 to 2 grams of powder. And the next type of dosage form is tinctures. These are the sweet, viscous, liquid oral preparations containing a medical substance which have a demulcent, sedative or expectorant actions. Example for this is codeine tincture. So these are alcoholic or hydroalcoholic solutions of a chemicals or a soluble constituents of a crude drug. Example for this is orange tincture, ipecac tincture, cardamom tincture. So they are mainly prepared by using certain sort of methods like maceration, percolation, simple dilution. And the next preparation is spirits. These are the alcoholic or hydroalcoholic solutions of volatile oils which are used internally for their medical values along with flavoring agents. Example for this is aromatic spirit of ammonia. And next type of preparation is proof spirits. They are defined as the mixture of alcohol and a water which is 51 degrees weight, 12 by 13th of an equal volume of water. The strength of an alcoholic preparations are measured in degrees, that is overproof or underproof. Any alcoholic solution which contains 57.1% volume by volume alcohol is a proof spirit and said to be 100 proof. And next type of preparation is elixirs. So elixirs are the clean liquids oral alcoholic preparations contain potent and nauseous drugs which are plentifully flavored and usually attractive color. They are stable than the mixtures. Here there are two types, that is medicated elixirs and non-medicated elixirs. For medicated elixirs, examples are compound benzaldehyde elixir. For non-medicated elixir, example is chlorpheniramine and chloral hydrate elixirs. Syrups. Syrups are the concentrated aqueous preparation of sugar or a sugar substance with or without flavors along with a medicament. So there are again of two types, that is medicated syrups and non-medicated syrup. So syrup IP is 66.7% weight by weight solution of sucrose, whereas syrup USP is 85% weight by volume or 64.74% weight by weight solution of sucrose in purified water. So according to IP and USP, these standards are needed to be maintained for the preparation of syrups. And next preparation is draughts. Draughts are the oral liquid preparations meant to be take a single dose. A single dose of a mixture is usually known as a draught. Example, melphalan peraldehyde draught. And the next type of preparation is drops. Drops are the liquid oral preparations of a potent drugs or a vitamins which are given into original form without any dilution. Eardrops. So eardrops means these are the liquid preparations which are meant for instillation into the ear obviously. So in these preparations, the drug is dissolved or suspended in a suitable solvent such as propylene glycol, polyethylene glycol, alcohol, water or a mixture of these. So here the aqueous solution is generally not preferred because secretions in the ear are fatty in nature. As such, these do not mix with water. And the next type of preparation is eye drops. So these are the aqueous and oily solutions or suspensions of one or more active component for instillation into the eye sac. So these are stable, free from foreign particles and irritating substances. These are the products which are needed to be sterile and isotonic with the lacrimal secretions. So they contains auxiliary substances such as isotonicity agents, buffering agents, antioxidants, stabilizers and preservatives. And the next category of dosage form is ointments. Ointments are the semi-solid preparations intended to be adhered to the skin or certain mucous membrane. So they are usually solutions or dispersion of one or more medicaments in non-aqueous base like fats, oils, waxes of vegetables or mineral bases. Eye ointments. These are the sterile semi-solid preparations of homogeneous appearance intended for application to the conjunctiva or margin of the eyelids. They mainly contains one or more active medicaments dissolved and dispersed in a suitable base like soft paraffin, liquid paraffin and a wool fat. They mainly contains a suitable amount of antioxidants, stabilizers, antimicrobial preservatives. The next category is gargles. Gargles are the aqueous solutions used to prevent or treat infections. They are usually available in concentrated form with direction for dilution with warm water before use. So they are mainly brought into intimate contact with the mucous membrane of the throat and are allowed to remain in contact within for a few minutes before they are thrown out from the mouth. So example of gargles are phenol gargles, potassium chloride gargles. Creams. Creams are the viscous semi-solid preparations which are usually aqueous creams or oily creams. So aqueous creams means these are O by W type emulsions. Oily creams are W by O type emulsions. So here the creams are usually pseudoplastic and exhibits a low yield values. So the microstructures of the O by W creams may be comprises several phases such as viscoelastic gel with water in fixed amounts, dispersed oils, free water and crystalline materials from fatty alcohols. So here the rigidity can be increased by inclusion of a high concentration of agents which is usually admixtures to acetyl and sterile alcohols and a surfactants. Next one is gels. So gels are the transparent or a translucent semi-solids or a solid preparations consisting of a solution of one or more active ingredients in a suitable hydrophilic or hydrophobic basis. They are made with the aid of suitable gelling agent. Next one is paste. These are the semi-solid preparations for topical application that differ from the similar product in containing proportion of high finely divided medicaments. So they are much stiffer than the ointments. They are mainly used as absorbents, antiseptics, poultices. So it consists of moistened masses of a vegetable materials or a clay that are sometimes heated before application. Here penetration enhances. Example sulfoxides, amides, surfactants, pyrrolidones, calcium thioglycerates, propylene glycols. Tablets. So tablets are the solid unit dosage forms intended to be administered into the oral cavity. They are prepared either by molding or by compression methods. So it is a well-known dosage form. Tablets are swallowed wholly and some after being chewed. Some are dissolved or dispersed in water before administration and some are intended in mouth where active ingredients are liberated. So these are the tablets. Next dosage form is capsules. Capsules are the solid unit dosage forms usually containing a drug enclosed within a small water soluble shell of suitable form of gelatin. There are two types, hard gelatin capsules and soft gelatin capsules. Here hard gelatin capsules are generally used for filling of solids. They contain a body and a cap made of gelatin, water, plasticizers and preservatives. Soft gelatin capsules are used for filling of solids, liquids as well as semi-solids. The shell of a soft gelatin capsules are formed, filled and sealed. They contain a large amount of plasticizers as compared to the hard gelatin capsules which provide flexibility to the shell. Pessaries. Pessaries are the solid dosage forms meant for introduction into the vagina where they melt or dissolve and exert its local action. Example, pessaries of clotrimazole, nystatin, istamol. Next type of dosage form is paints. So paints are the solutions of one or more active ingredient intended for application to the skin or mucous membrane of the mouth and throat with the help of a small brush or a cotton swab. Here the throat paints are generally more viscous due to high concentration of a glycerin which being sticky adhere to the affected area and prolongs the contact time of the medicament. So because of the glycerin only it will produces a prolonged action. Example, compound paint of iodine which is also known as Mandel's paint crystal violet paint. Linctuses. These are the viscous sweetened liquid oral preparations used to relieve for cough. They are the simple solution or admixtures containing high amount of syrup and sometimes glycerin, so which in addition to give a sweetable taste to the preparation, so which have a demulcent action on mucous membrane of a throat. Example: codeine linctus, tolu linctus. Pills. So pills are the small rounded solid dosage forms containing one or more active ingredient meant for oral administration. These are most extensively used oral dosage forms, but they have been largely replaced by compressed tablets and capsules nowadays. Example are phenolphthalein pills. Lotions. Lotions are the liquid or a semi-solid preparations which are meant for application to the unbroken skin without any friction. They are either dabbed on the skin or applied on the suitable dressing and covered with a waterproof material to reduce the evaporation. So they mainly contains antiseptics, astringents, anesthetics, germicides, protectives, screening agents. Example for the lotions are calamine lotion. Liniments. They are the liquid or a semi-solid preparations meant for application to the skin by friction. So they may be alcoholic or oily or a soap solutions or emulsions. So alcoholic liniments are usually for rubefacient, counter-irritant, mildly astringent, penetrating effects. They should never apply to the broken skin. Example for liniments are turpentine liniment, camphor liniment. Lozenges. Lozenges are the solid dosage forms containing medicament in a sweetened and a flavored base intended to dissolve slowly in the mouth. So the base may be a hard sugar candy, glycerinated gelatin, or a combination of a sugar with a gum to give it forms. So here they do not disintegrate in the mouth but dissolve slowly, liberating the active medicament, which may be an antiseptic or a local anesthetic or an antibiotic, antitussive, analgesic, antihistaminic. They are also known as crutches. Mouthwashes. Mouthwashes are the aqueous solutions which mainly contains one or more active ingredient for use in contact with a mucous membrane of oral cavity, usually after dilution with a warm water. So they mainly deodorizes the mouth. Sometimes they will refresh the mouth also. So they mainly contains additives like alcohol, glycerin, synthetic sweetness, surfactants, flavors, colors. By incorporating all these additives, we will prepare the mouthwashes. Nasal drops. So these are the solutions, suspensions, emulsions containing an active ingredient intended for instillation into the nostrils, usually with the help of a dropper. So nasal drops are mostly aqueous vehicles. So oil drops are not common, so sometimes not preferred also, since oil may render the ciliary actions of the mucus, which causes a lipoidal pneumonia if drops of oil enter the lungs. Nasal sprays. They are the suspensions or the solutions of a drugs intended for spraying into the nostrils. Uses of a nasal spray are to relieve nasal congestion and inflammation and to treat infections. They are intended to be retained in the nasal tract. Usually they are viscous, coarse, since fine droplets tends to penetrate further into the respiratory tract. So they are generally supplied in a pressurized container or a plastic squeeze bottles. So these are the various types of pharmaceutical dosage forms. Thanks for watching this video. Please subscribe to our channel for more videos.